Welcome to MPTI. My name is Chris Williams, Director of Education. Today we'll be looking at a series of exercises that are appropriate either pre-rehabilitation or post-rehabilitation for a herniated disc. What we do have on the board here is a graphic that illustrates a herniated disc. This is the nucleus pulposus that comes out of the fibrous layer called the annulus fibrosus, and as a consequence it will lead to severe pain after that pain is generated down your butt cheek into your lower leg. So you'll know distinctly and definitively if you have a herniated disc, although it's best if you get an MRI or some type of a clinical diagnosis to make sure you're conclusive before you start to administer any type of post-rehab exercises. Within the context of personal training, the way it works is this. First of all, you are diagnosed with a clinical pathology. Then you will have physical therapy of sorts. After you're released from a physical therapist, then we do post-rehabilitation. That's what we do. So the first series of exercise that we're going to do with our client here today, who has been cleared by a physical therapist and who is indeed will be doing post-rehab, is a quadruped series. We're starting with 6 points of contact, which are 2 feet, 2 knees, and the 2 hands, which are directly under the shoulder. We call this for a box formation. And what I want Zach to do is lift the opposite arm and opposite leg and probably hold that position for about 3 to 5 seconds. When he does so, we want to make sure that everything is aligned, so the head, thoracic spine, and sacrum is in alignment. And we're going to hold that for 3 to 5 seconds before we change over to the other side. So one more demonstration on the opposite side. And we'll do this for 12 to 14 repetitions. Numbers are always great, but more importantly, the significance is that every time you do it, your form is correct and you're engaging the correct muscles, and relax there. Once our client has perfected this particular skill, we're now going to increase the level of difficulty by lifting the feet. So now we have 4 points of contact, that being the knees and the hands. And we're going to ask him to do exactly the same. So it's a contralateral movement. Opposite arm, opposite leg lift. Nice and steady, keeping everything symmetrical. And engage and relax there for me and change up to the next side. Wonderful. And you can clearly see we're still on a static surface. There's nothing dynamic yet. That's to follow, and relax there. So we now have some options for the quadruped. After which, we're going to take him from a static surface, that being the ground, and we're going to use the upper side of the bosu, which is going to move significantly as he performs this exercise. If I can ask you to now put your knees on this for me and perform the same exercise, that would be great. So this is an advancement. How long does it take to advance somebody with this pathology? Well, your guess is as good as mine. The healing process is very different in all of us. So it might take a matter of weeks, it may take a matter of months. So it's a slow process and it should be done correctly. So when you're ready, my friend, opposite arm, opposite leg, again. And as you can clearly see, he is shaking a whole lot more because the demand is that much greater. Okay, and change up for me. Let's do one more rep on the next side. Wonderful. So clearly our client here has got great levels of stability, and relax there for me, intrinsic core stability. So ideally what we then do is we start to apply, once they've got this level of stability, apply external resistances. For example, I could put a band here and just give him a slight pull, either on the ground or on the bosu, to kind of perturb his center of gravity from a transverse axis, and that will increase the level of difficulty of that particular exercise. But like I said, that's quite advanced, and so that might be a few months to a year down the line. That's the quadruped series. The next exercise that's also safe, so if I can get you to jump up for me please, thank you, for people with indeed a herniated disc, are indeed planks. So plank, we've got 6 points of contact. We're going to have 2 knees, 2 feet, and the 2 elbows down, just slightly. And we're ensuring that the head and the ears dissect the shoulder, and there's a straight line principle right down through the hip and the knee. Now, how long? I would suggest probably 10 to 15 second holds would be fantastic. We don't want to prolong it where they start to really go into an anterior pelvic tilt or start to sag excessively. Relax there for me. From here, when they've mastered this skill, now we're going to go to 2 knees down and lift the feet. So 4 points of contact. At this stage, it would be great if you did not actually crush your legs because it disengages the glutes somewhat, and we want these to fire. So again, we got the straight line principle, but it's a little bit more demanding because we only have 4 points of contact with the ground. And then from there, we're going to go into a plank, which is this. And again, if you can give me 15 to 20 seconds of that, maximum intramuscular force output to help stabilize the vertebral column by engaging the intrinsic core muscles, that's the whole purpose. And if you can do anywhere from 1 to 3 sets of that, that'll be a great way of moving forward. And then time can be a parameter of intensity. And relax there for me. And again, once we've mastered the skill on the ground, we're then going to start to use dynamic art forms. So in this case, we're going to be using the top side of the Bosu again, and in this case, we're going to ask you to put both of your elbows. We're going to do a plank, like so. And this is just a little bit more dynamic. And once your client get used to this movement pattern, you can choose to either perturb their body, or you can do this so that it actually recruits the muscles a whole lot more. But you would only do this once they've progressed and they have great form and they've got good controlling mechanisms at play. You wouldn't do it in the early stages because it can be really undermining to their emotional and psychological status, especially if they've had this particular trauma as a consequence of some type of an injury, a car accident, or some type of a trauma of that magnitude. And that's your personal training tip of the week.
Thanks for visiting NPTI Florida, Orlando, Tampa locations. We truly appreciate you guys following us, liking, subscribing. We're going to do a really good job this year, giving you guys as much information about the personal training industry. If you're passionate about helping others become healthy, your career starts here at NPTI Florida. 600 hours fully accredited education will get you where you need to be. Continue watching us, folks. Subscribe below, and have a great week.